Hi, I've been asked by a follower on Twitter to talk about how individuals on the autism spectrum can get accommodations in the workplace. There are a lot of different things that we can address in this topic, and so today I'm going to talk about just how to talk to a supervisor about your own strengths and weaknesses and how they apply to being on the autism spectrum. So I think that it's good to look at being able to identify for an employer or supervisor both strengths you bring to the job as well as any areas that are areas of difficulty for you, so that they can see that it's not just areas of difficulty. Because I really believe that that's true, but not everyone knows about that, both those strengths and weaknesses, and I think it's important to point out, especially in a workplace setting where someone is wanting to keep their job and to be a good employee and so forth. So one way to do this, I'm going to first assume that that it's okay to talk about the specific diagnosis, and I'll give an example a little bit later as if you don't feel comfortable disclosing the specific diagnosis. But if it's either already known or you're disclosing it for the first time, I think that it would be possible to say something along the lines of, I have Asperger's syndrome, and what that means in my current job is that there's some things that I'm particularly good at, and there's some things that I might need a little more help or support with than others. Some of the things that I'm really good at are the facts and figures of the job, and on being reliable and coming every day the way that I'm supposed to, and following all the rules and regulations here in the workplace. There's a couple of areas that I have more trouble with, and those would be that I sometimes can get a little bit disorganized, and I could probably benefit from someone helping me prioritize which tasks I should do first in, say, a given day or a given week, and also that I'm not that great at some of the social events that take place in the workplace, and therefore I just like to ask that you don't have high expectations that I'm going to want to socialize with everybody and go out to lunch and go to work parties and so forth, because that's not something that I really enjoy that much. So that would be an example of what someone could say to describe some of the strengths that they bring into that workplace, and a couple of areas that could be identified as weaknesses or preferences. And the way that that could be done in different settings would apply to whatever it was that that person had to do in their line of work. So for instance, if someone was a programmer, or if someone was stocking shelves, or if someone was a cashier, there might be different things that they would say. So for instance, one person that was a cashier might say, I know that I'll be really good at all the details of my job, and that my drawer will always balance, and that I'll be very careful that I get the parts done of checking in and checking out at the beginning of each shift. They'll always be done, correctly. However, I might not be quite as good at making casual conversation with all the people that come to my check stand and looking at them and smiling at them. But I will make sure that I'm doing my best, and I'll probably be able to keep improving on that over time as I get more comfortable in that position. So that would be another example of how someone who's a cashier might talk about some of their strengths and weaknesses. And I think the same strategy can be used if, for whatever reason you've chosen, you're not discussing the diagnosis with your employer or supervisor. And the only way that you do that differently would be just to say, instead of I have Asperger's syndrome or I have high functioning autism, you might say, I am the kind of person who. So it might be, I am the kind of person who finds facts and figures about the job come really easily to me, and I'm also the kind of person who doesn't really like to socialize that much, and so I don't want anyone to take that personally, or think that I don't like them. It just means that I'm somewhat shy, and I prefer to do things on my own when I'm not here at work. So I think either way that the strategies can work. Sometimes people are getting some sort of official type of accommodation in a workplace, so maybe they've gotten the job through the help of a special agency, or they've had a job coach and so forth, and then it would always be very appropriate to be talking about the actual official diagnosis. Many people haven't used a special program to get their job, and they're just applying for the job or getting a job just the same way that anyone else would, and therefore they might be deciding, whether they're going to give the diagnosis to their employer or supervisor or not, and that's just something that's individual choice. So I think there's ways to ask for that kind of help and to focus on both the strengths you bring in and any weaknesses that maybe you could use some support on. And this also really helps educate employers and supervisors about the needs of their employees. And we all know that every employee brings certain strengths and certain weaknesses to the job. And so this is just a way to identify what those would be for you. So my name is Barbara Lester. I'm a licensed clinical social worker, and I've been working as a therapist for almost 30 years, and I specialize in working with the needs of individuals and families that are affected by autism. So thanks for stopping by. If you're interested in these kinds of tips, please subscribe to my channel, which is ASD Specialist on YouTube, and I'll be doing some other videos as relates to the needs of those on the autism spectrum in employment situations.